tusaidie choo zitolewe hapo hivyo mali wamewekwa, walete huku nje kwa sababu harufu yenye inaingia inatuaffect sana kama tunasoma.
The voice of the child is also very, very important.
Open sewage routes, in addition to the common use of flying toilets, also contribute to contamination of the slum. Living conditions are particularly poor as the government does not provide basic water and sanitation services due to the fact that the slum is an illegal settlement. Overcrowded conditions spread diseases like typhoid, worm infestation and skin diseases quickly, and children suffer poor health because of inadequate nutrition and lack of access to clean water and sanitation.
The thing which I would like to change in this school is toilets, foods. I would like you to help us to put them in the good way.
But the picture is not as gloomy in Kibera, Lainisaba and Mashimoni villages, whereas Amref and GlaxoSmithKline and other partners are working with the communities to improve personal hygiene and sanitation, as Sakwa Mwangala, the manager for Amref Kibera Integrated Project, states.
Living conditions in Kibera are very poor. Water sanitation is very poor. Access to health is very poor. And generally the communities live within the low poverty levels.
The slum has various challenges in terms of education. We realize that the rate of dropout and enrollment is quite low. By the time we get to around class 6, about 40% of students have already dropped out of school, mainly because of poverty and because of lack of facilities that definitely support learning in school.
With such appalling living conditions, Amref, in partnership with GlaxoSmithKline, put into action the Kibera Personal Hygiene and Sanitation Education Program, also known as FACE. The Kibera FACE project is a 3-year project whose function is to improve health in the informal settlement in close partnership with government ministries, teachers, parents associations and local administration.
Personal hygiene and sanitation education is important because diarrheal diseases are one of the single largest killers of children in Africa. And addressing that particular component of disease will enable African children live longer, feel better and do much more.
Although FACE has been implemented in the formal settlement, Amref saw there was need to have it implemented in the informal settlement, with Mashimoni and Lainisaba villages being successful pilot projects. FACE therefore educates peer educators who in turn train children in ways of personal hygiene, such as washing their hands at appropriate times, such as before meals and after visiting the toilet. FACE works with children as they are seen as an effective way to educate their peers, families and communities.
Kuhusu FACE, hawa watoto wametufundisha mambo mingi sana. Kitu ya kwanza wametufundisha jinsi ya kunawa mkono, vile nitakana kiafya.
It has helped us to know how we should be clean, how we should wash our hands, what we should do before eating, what we should do after going to the toilet, and has helped many people and many pupils to become clean and to unite and become one friend to one another.
Children are seen as change agents in the community on ways of improving their health and hygiene practices and providing better sanitation facilities. Waste management and nutrition are some of the other byproducts of FACE, therefore empowering the youth, creating a clean environment, self-dependence and self-reliance.
They started the water project, so they gave us a tank and they enabled us to install the water.
We have trained our children through the help of our TOTs. The children have now become responsible.
Some of the greatest achievements that have been witnessed so far is knowing that by September of 2009, a total of 9,275 children had access to safe water and appropriate sanitation, following construction of latrines and the establishment of hand-washing points in all schools. There has also been a notable change in health behavior, with over 75% of children washing their hands with soap at appropriate times, therefore having up to 7% reduction of water and sanitation-related diseases among pupils.
It has reduced the rate of having diseases in our body because 80% of the diseases in our body is caused by germs.
For a country to move on, there is need for development in all areas. And this is why Amref plans for FACE to continue working with communities to improve the health status of the residents of Kibera, together with all other stakeholders and partners, and to scale up the FACE initiative to cover all of Kibera and perhaps all informal settlement in Kenya.
I always see the toilets which have been written Amref, Amref, and I've never seen Amref in our school helping us. But I think they will help us because of the toilets. They are in a bad place. They are in underclasses.
I want to see FACE everywhere in this country in the future, because we believe that if everybody will be practicing the principles of FACE, then it means ultimately that this country would have reduced remarkably the preventable diseases.
We need to find a different way of making sure that each and every school in Kibera benefit from FACE, and preferably other informal settlement in Nairobi. For that reason, we need to get in partnership with other partners on the ground that are doing actual activities, get them to work on FACE like a FACE movement.
Everybody has a responsibility towards making the life of children much better. One person cannot change the world, but you can change the world for one person, for one child. The children are our future.